Hi, I'm Kelly Vess, and I'm so excited to discuss this very important topic with you today of target selection. So, the question is this: are you going to select a simpler treatment target for your client, or are you going to select a more complex treatment target for your client? The answer to this question will determine how effective you are as a speech therapist as to whether or not you're going to produce minute gains in therapy or huge gains in therapy. So, what we're going to do is we're going to take a look at the complexity approach and the idea that the complexity approach is not evidence based. Let's take a look at the evidence and see if that is true. And also, we're going to take a look at how the complexity approach works in terms of speech development. So, let's start off with a little bit of background. What we have to understand is taking a step back, if we look at all of the languages around the world, there's this innate sequence of how language develops. So, in all languages around the world, first we're going to have the vowel sounds develop. After the vowel sounds develop, we're going to have the stop consonants develop. And that's where the airflow stops, such as the pa, ba, ta, da, ka, ga, na, ma. And then after the stop consonants, we're going to have the fricative consonants. With just as the name implies, you have some friction in the airflow. Sounds such as fa, va, sa, sa. There's friction in the airflow. So that's one step more complex. Then we have something known as affricates. And affricates are a combination of stop consonants and fricatives in which the airflow is both stopped and then released in a friction sort of manner. After that, we're going to have two element clusters, words such as sweet, SW, where two neighboring sounds are produced together. And then finally, on top of those two consonant clusters, we'll have three element consonant clusters, which is a word such as scrape, SCR in the word scrape, which is the most complex consonant cluster and the latest developing in the English language. So when we look at these consonant clusters, it's innate. It's like teeth. Yeah, they're going to develop in this sequence no matter what we do. This is nature. This is not nurture. So although we're speech pathologists, and although we know that we do make a difference in the treatment of speech sound disorders, we also know that we don't change the sequence. The sequence is innate. It doesn't matter. We're nurture what we do. What we can do is we can expedite the process of growth and we can make it go faster by choosing more complex sound combinations. We can speed up the development of stop consonants, of fricative consonants, of affricates, of two elements, and then of three elements lastly. So that's what we can do as speech pathologists. We're not speech fairies, we're speech therapists, and we do make a difference in this area, but we don't change the innate sequence of the development of sounds. To understand this, I like to liken it to teeth, okay? When our teeth develop, we're always going to have the central right here incisors first, then the lateral incisors, then the canines, and then the molars. Nothing the dentist is going to do is going to change that. That's how the teeth are going to come in, period. The speech sounds are the same way. So, keeping that in mind, let's look at the research. There is one study that is 20 years old that has taken our field off the train tracks from the complexity approach and has said or stated that the complexity approach is not evidence based. The problem is that this study is very misinterpreted. The results are very misinterpreted and it's very poorly constructed. And we're going to talk about why. But let's keep that in mind about how speech develops. Earlier sounds will develop before later sounds. We can just quicken the process, but we can't change the order. Okay, so we're going to take a closer look at the research and look at that study that then this year is 20 years old that took the train off the track. There was a lot of research to indicate that more complex treatment targets produced greater gains, resulting in system-wide change, resulting in a cascading effect in which earlier sounds developed more quickly. So the children were ascending the staircase at a quicker pace if we chose a more complex consonant cluster. But then there was a study in 2001, and it came out of McGill University from Susan Ravachol and Michelle Nowak. And what they claimed in their study is that the complexity approach is less effective than the developmental simple treatment target approach. And that is because this is where they compared a grape to grapefruit, and you can't do that. When you're doing research, you need to compare apples to apples. You can't compare grapes to grapefruits. And in this case, they compared an early developing sound, and they assigned children an early developing sound, which quickly develops and will develop first no matter what you do, to a late developing sound, which will develop last no matter what you do. Because this is innate. We cannot change the sequence of development. We can only expedite it. So what this study found is they said, well, we gave this simple sound to this group, and we gave this complex sound to this group. And the children with the simple sound, they made more progress in the simple sound than those with the complex sound. The ones with the complex sound, they made less progress with the complex sound. Well, of course that is the case, because you're comparing something that will naturally develop and quickly develop to something that takes a long time to develop and will develop lastly no matter what you do. So putting this in perspective, when we work with children that are highly unintelligible, we work with 3-element blends. We'll work with an SQU blend as a starting point with the child who's producing vowels by using a maximum level of cueing. Now, is this child walking around saying 3-element clusters? Of course not. The child is producing vowels, then stop sounds, then fricatives, then affricates, then 2-element blends, and at the very last level, 3-element blends. So we cannot change the order of the development. We can simply expedite it. So this study that basically confirmed what we know all along. It confirmed that earlier sounds develop before later sounds. It's a perfect textbook example of correlation does not equal causation. Yes, it is true. Earlier sounds develop before later sounds, no matter what you do. But that does not mean that the early speech development approach is more effective than the late developing approach. So what this study, when it went off the tracks, and this study was good up to the point where they said, where they're measuring a grape versus a grapefruit. They're measuring something very small versus something very, very big. And they're saying, therefore, this is more effective. That's where the train went off of the tracks, is they're not measuring apples to apples, but then it went even further off the tracks when it made the interpretation, ergo, because earlier sounds develop, which they always will, before later sounds, the developmental approach is more effective. Correlation does not equal causation. Had this research study looked at all of the sounds in developing in the child's speech, had the research study compared an articulation assessment or a percent consonant correct versus articulation assessment, percent consonant correct, then we would know the value of the treatment target. Then we could compare apples to apples. We could say, is it better to choose a P or is it better to choose an R as a treatment target? And we could look at the gains. And what our research has clearly shown is that if you choose that 3-element consonant cluster, you're going to get much greater gains than if you were to choose a 2-element consonant cluster or an affricate or a single sound, or go the lower you are in the staircase, the less the gains. But this is a study that I think it's very important. And when we look at this study, why it's important to critically read research, because this was a study that was published in the most highly esteemed journal in our field. And it made the interpretation based on correlation equal causation, which does not, that the developmental approach is more effective than the complexity approach. That is not the case. And now, at this time, 20 years later, in our field today, in the field of the American Speech, Hearing, and Language Association in itself, there's a plethora of research to show that complex treatment targets results in greater gains in the areas of pragmatic intervention, greater gains in the areas of literacy intervention, greater gains in the areas of syntax, sentence level grammar intervention, greater gains, more complex targets in the area of morphological development, greater gains in the area of vocabulary semantics, and greater gains in the area of the speech sound disorder treatment. So here we are 20 years after that train went off that track, and we need to read that study and look at that study. And I see it as a classic textbook example of when someone took correlation, which is, yes, earlier sounds were always developed before later sounds, and misinterpret it as causation. Okay, it's time to get the train back on the track, and it's time to be more effective at what we do, because challenge creates change in the brain. And it's not only in the field of speech language pathology that this research is coming to light. It's in the field of neuroscience. It's in the field of educational pedagogy. It's in the field of gross and fine motor movement. It's in the field of kinesiology. It's in the field of literacy intervention. All across these fields, outside of the field of speech language pathology, we are finding that more complex treatment targets produce greater gains. Challenge creates change, period. If you want to make a difference with the clients you service, you have to select complex treatment targets to produce system-wide change, particularly if you're working with young children before the age of 6, when neuroplasticity is at its greatest level, and you have the power to rewire the brain and truly create lifelong change. We need to put the train on the track, and we need to get moving forward.